Hypoxic ischemic encephalopathy. What is hypoxic? Hypoxic is the reduction of oxygen supply. Ischemia is the insufficient blood supply. Encephalo means brain. Opathy means disease. So there is a decreased blood supply leads to decreased oxygen supply that causes the disease in the brain region. That is called hypoxic ischemic encephalopathy. Myself Sukumiii, I am the student of occupational therapy. What is asphyxia? Asphyxia is the reduction of oxygen supply due to low oxygen in the blood, which means if we are in carbon monoxide room, so our blood is having only carbon monoxide, there is no oxygen in our blood. That is called asphyxia. So what is birth asphyxia? During delivery, during birth condition, so the environment is full of carbon dioxide or any other gas, not oxygen is available. So the baby intake only carbon dioxide something. So that is filled in the blood and that blood is circulating in his body. That is called birth asphyxia. In fetal asphyxia, some of the manifestations are very low or very high. Example, tachycardia or bradycardia. Tachycardia means increased heart rate. Bradycardia means decreased heart rate. Fetal movement is increased or decreased. So these like contra symptoms. So increased also same problem, decreased also same problem. By using Apgar scale, we can say the degree of the asphyxia. If the Apgar scale score is about 8 to 10, then it is no asphyxia. If it is 4 to 8, then mild asphyxia is muscle tone response to the stimulation. So this is tabulated here. So you can view and how the score is described. If 1 is present, so if the heart rate is below 100, then it's called 1. If the color of the trunk is blue, then the score is 1. So that's like we can calculate the score. If it is 8 to 10, then there is no asphyxia. If the child has asphyxia, there is a complication called hypoxic ischemic encephalopathy. Not only this complication, in CNS, this complication is there. In respiratory system, pulmonary hemorrhage or any other hemorrhage. In cardiovascular system, shock. In gastrointestinal region, ulcer, hypoglycemia, hyperglycemia. So these like complications are occurs if there is an asphyxia is present. In HYE, hypoxic ischemic encephalopathy, there is a damage to the brain. So there is a insufficient blood supply to the brain. It leads to mortality or else there is a long-term disabilities, long-term sequelae will be present to the affected individual. They may be affected. I am going to tell etiology as well as risk factor as well. So how? So if the baby has hypoxic ischemic encephalopathy, then the mom has these symptoms. So then it is a etiology. If this is present in the mom, then it may cause the HIE, anemia, diabetes, hypertension, smoking. So the mother may be too old or too young, or else mother have heart disease, delivery factors, abruption of placenta or prolapsed cord, umbilical cord, fetal factors, congenital malformation, or multiple attempt to birth leads to this hypoxic ischemic encephalopathy. Immediately after asphyxia, our own system protect our vital organs like heart, lungs, and brain from the hypoxia. How it protects by the diving reflex. So it reduces the blood supply to the limbs and other areas, and it increases the blood supply to the heart, lungs, and the brain. So by its own mechanism, it protects the vital organs and save the life of the individual. So initially, the cellular damage are very mild and it can be reversible. So after oxygen supply, the cells are regain its work and it start working. If the hypoxia is prolonged, then the cell damage can't be reversible. So it is irreversible. What are all the symptoms? Excitation and depression. What is excitation? I already said tachycardia, bradycardia. Excitation is a tachycardia. Depression is a bradycardia. In excitation, the person may hyper alert and irritant, having more muscle tone, having frequent breathing, tachypnea, may have seizure. These are all present in excitation phase. If the hypoxia is prolonged, then it may go to the severe stage. Then it shows the symptoms called depression symptoms: coma, hypotonia, bradycardia, reduced heart rate, reduced breathing frequency, bradypnea, and there is no response when the stimulation, unresponsibility. These are all comes when the person goes depression. When the person goes depression state, if the hypoxia is prolonged, so in mild stage there is a boost, and after that there is severe depression. So to see the response, so we are using the second response. So to see the mild, moderate and severe, we are focusing only four features: consciousness, muscle tone, seizure and second response. In mild there is no seizure. In moderate and severe there is a seizure present. So this seizure may lead to cerebral palsy also. What is the management of HIE? First we have to monitor some things. First, vitals. I already put a video for the vitals. I given I button, so you can watch the what are the vital signs, what are the cardinal signs you can see. Then we have to monitor what is the urine output of the child. Then blood sugar monitoring. Then PCB. What is PCB? For anemia we can check the PCB. So total number of RBCs we can calculate. So in our blood is 100%. What is the percentage of RBC is calculated by the hematocrit, or it is called packed cell volume, PCV. And what are the electrolytes? So hypercalcemia, natremia. So that's like we have to check for the electrolytes. What are all the treatment? You can easily say there is a problem in oxygen supply. So we have to give oxygen. So we need ventilation. Not only ventilation required, there is a perfusion required. If the blood is flowing correctly, but there is a lack of oxygen in blood due to the blood can't perfuse the oxygen. So we have to focus on perfusion and circulation, and we have to focus on the glucose level. So there is a increased or decreased glucose level in the child, so we have to normalize the energy level. So energy level is also known as glucose level. Then electrolyte level should be monitored, and if it is lack in electrolytes, we have to give the sufficient therapy. Then we have to focus on the hematocrit level. It should be 55%. So it should not be exceed or decrease. So we have to maintain by blood transfusion or any other techniques we can use to maintain the normal hematocrit value. Then controlling the seizure. HIE seizures are very difficult to control. Phenobarbital, phenytoin can be used to control the seizure, HIE seizure. Some special investigation like EEG, cranial ultrasound can be used to investigate the level of the hypoxic. CT scan, MRI scan also we use. So MRI may be time consuming. So in many cases we avoid the MRI scan. To view the hypoxic areas, we have to take the MRI scan. So recent advances in management, that is cerebral hypothermia. What is hypothermia? There is a cooling process that is called hypothermia. Why cooling is needed? So if the brain is heat, then metabolism is fast, then it consumes more oxygen and more blood. So we have to prevent these metabolism. So we have to cool the brain, and it goes only cooling up to 33 to 34 degrees Celsius. It can be provided for 72 hours. Mild and moderate HIE can be cured completely, but with severe hypoxia, severe HIE may go to death or 50% of having the sequelae. There may be a paralysis or any other symptoms. So which area of the brain is affected, then that like symptoms are shown in our body. How to prevent it? We have to have the better obstetric care and skilled resuscitation team for the neonatals, and having good neonatal facilities. By this way we can prevent the hypoxic ischemic encephalopathy. Okay guys, in our video we see what is hypoxic ischemic encephalopathy and what are all the causes, what are all the complications, what are all the management, what are all the symptoms and so on. So I am continuously working to give more knowledge to you. So please support me for my work. So please kindly subscribe. Thanks for watching. So be proud to be watch the video. Thanks.